This
fly,
conference will now be recorded.
and that those were things that needed to be set up quickly, and they were really good at that. They also were able to make sure that the donors, uh, the people in the community who have donor advised funds with the Winston-Salem Foundation could be aware of this opportunity. And so they would be among the prime folks who would be able to make fairly significant gifts. And so they were able to take this message to them. Many of them are donors to United Way as well, and we share, you know, that people are generous in both ways. But they were able to get to them quickly, and so that was really important. What United Way brought to the process was we were able to leverage our digital giving platform so that it meant that anyone in the community who wanted to participate could do so. And people have given between $10,000 and $10,000 on that mobile platform, but it meant that the average person on the street in our community who wanted to help had an avenue to do so, and that was very important to us. The other thing that United Way brought was the 211 system, and I'll talk a little bit more about that in a minute, but 211 was the portal that we asked people to go to be able to get access to resources, and that was really important to be able to have a place to send them. The other thing that 211 was able to do is give us data about what the calls were, meaning what needs were being seen in our community and across the state. So I'll come back to 211 and give you some more specifics in a minute, but that was something that we fund year round. It's available 24 hours a day, 7 days a week, 365 days a year, online and by phone. And it was perfectly set up to be the portal for the needs and sending people in that direction to give them access to where they could find help to any kind of need that they were asking about or seeing in their life. So then together we did several things that we shared. One being that we shared approaching and having conversations with large corporate partners in our community, and they stepped up to making very significant gifts to this. So we have a very generous community, and that this was no exception. The other was we shared populating the committee and the criteria, developing the criteria around how funding would flow and to what organizations or to what you would apply for and what would be considered. And so we each brought some strengths, and then we had some shared strengths that we were able to leverage together. So far, the fund has raised $3.8 million for our community, and it is directed towards needs that have come out of the COVID pandemic. So it's been, that's an incredibly generous sum for a community of our size. We know that it's not enough, and we don't know that anything would be enough with the number of people who are struggling and who have seen job losses and who are seeing, you know, furloughs or cuts in hours or things like that. There is a significant need. But what this allowed us to do was respond quickly to some of the emerging needs that came out early on. And so at this point, 3.5 million of that 3.8 has been allocated, has been granted out to 75 different organizations in the community. And they are very large organizations, they are very small organizations. They are focused on a lot of different needs in the community. And, you know, each organization had to make a case for how their mission related back to what needs were coming out of the pandemic. And so, you know, 75 organizations were able to do that. And there was organizations that we wanted to make sure were able to work with some of the populations that maybe aren't part of the social or human service systems or don't get engaged with it as often. And so we had some very small organizations that have built very strong relationships with populations that may not typically engage with the social services in the community. And so we were very intentional, and I say we, I mean the committee who made the decisions about where the funds would flow to. I was not on that, nor was Scott Weirman, but we had representatives from each of our organizations, as well as a number of the organizations that put significant dollars into the pool, and a representative from the ministers conference. And so the folks on that committee put a lot of time and effort into assessing what the data was telling us the needs were, and what proposals we had received, what were applications we had received that would most address those needs. So I'll tell you a little bit about a couple of the organizations that got funded through that. And these are just representative. I'm going to talk about 3 out of 75. So if you go on the COVID-19 for Scythe.org site, you can see full lists of where the funding went. And if you also are there and want to make a gift, feel free to do that as well. We will have another round of funding in the future as we watch for emerging needs that we can't identify just yet. So the need is continuing, and if you're in a position to help, please do so. So one of the organizations that received funding was United Health Centers, and they were granted $100,000 to provide affordable and comprehensive health care to underserved community members, and also to make sure that educational materials about the pandemic were being distributed in both English and Spanish. So they gave access to health care in the middle of a health crisis for people who don't have access to regular health systems, who don't have insurance, who can't access health systems because they're not documented. And so this was a crucial institution to make sure that it remained able to serve at a time when health needs were just escalating quickly, and we couldn't find enough resources in the community to address them all. And so they have really stepped into that and provided a very strong application, and that was a great way to make sure that we were bolstering health systems within the community. The YMCA also received $100,000, and it was to adapt services and provide emergency childcare, coordinate community food distribution, and make wellness calls for seniors. So what they did is they looked at what they do well, and they figured out a way to do it in a new way in a time when they couldn't continue to run business as usual. And so we wanted to make sure that, there was obviously food was a huge crisis at the beginning. Second Harvest Food got $100,000 to be able to address that huge press of requests that they were seeing, especially in late March and early April. Crisis Control received $100,000 to be focused on those who were looking for assistance in rental payments. That became very quickly a huge need in our community. And then another funding organization that was funded was Legal Aid of North Carolina. So one of the needs that we saw come out of this at the very beginning, and it was identified through the 211 system, is there is a high number of people in our community who live in motels and hotels. And this isn't just our community, it was statewide. It was the #1 call across the state, people who were living in hotels and motels and who were afraid of being evicted. If you live in a motel or hotel, you're paying your rent by the week. And so you're never more than 7 days away from eviction. And so people who are living in those places are paying by the week because they can't afford to make a first month and last month down payments all at one time with a security deposit. But they can afford to keep a roof over their head if they can pay weekly. And most of them are under the radar. They're not part of any of the systems in the community. They're not part of the Department of Social Services systems. They're not part of the nonprofit systems. They are managing to keep themselves and their family sheltered and fed by living in motels and hotels, except that they were disproportionately the population that was affected by job loss immediately. And so they had no income and were looking at what they thought was an immediate eviction. Legal aid was willing to step in. That's not one of their core focus areas, but they were willing to step in and start negotiating with the hotels and motels, because the same restrictions that were put in place by the governor around a moratorium on evictions from people who live in apartments, who are renting, apartments, that moratorium also applies to motels and hotels, but people didn't understand that. The motel and hotel owners didn't understand that. The tenants who lived in it didn't understand that, nor did we. And so legal aid was in a unique position to understand that and be able to start having conversations about how to make sure that people didn't get evicted, didn't become part of the homeless system, because at the same time in our community, we were having to take our homeless system apart in some ways, because the homelessness system is built on congregating people in shelters to make sure that they are not living on the streets. Well, when you're saying people have to be socially distanced and isolated, that model doesn't really work anymore. And the other thing is we know that many of those in the homeless population have underlying conditions and are medically fragile. And so trying to ensure that they were going to be able to remain safe and not have a full-blown mini epidemic in the homeless population meant that we had to change a lot of our systems and get people spread out. We had to diminish the number that each shelter was able to accept, so that they could provide more space around the people who were coming to them for services and shelter. And so having a huge number of folks who were facing homelessness, because hotels and motels were going to be, could have possibly been evicting, was going to put a stress on our community that we were not prepared for. And so legal aid received money through that first round of funding in order to be able to keep that population sheltered in place in their hotels and motels. And so that's been a really interesting learning for us in the community. We did not realize how many people lived in hotels and motels, because again, they were kind of off the radar. They are part of the grid of systems. And so to have them, for us to realize that that was the #1 call across the whole state was a little disconcerting and surprising. And so that has, we were able to react. And the reason we could react quickly in our community was because we had the COVID fund that was ready and able to put funds towards addressing a problem that when we started raising the money, we had no idea was a problem. And so the COVID fund allowed immediate response to problems that we couldn't even begin to see coming at us. And so I've mentioned the 211 system. So I see a question about, do I think there's going to be an increase in homelessness even though there was help provided? I am going to talk about that a little later. So I'm going to hold off, let you know I did see your question, because I'm going to talk about that. That is something that we are thinking about and a little focused on right now. But let me tell you about 211. So I mentioned that it is available 24 hours a day, 7 days a week, 365. And it's a statewide system. So you could call in any of the counties in North Carolina and dial 211 and you get to the same place that would be able to give you information about your local community. You could also call from Forsyth County and ask for resources in Chatham County for a family member or any place else, and you can get those. So it's not limited to you learn about things that are available in your community, but you can learn about things that are available in other communities for family members that might live elsewhere. And so for us, not knowing what the needs were, what was, we could assume, and we would have been right with some of our assumptions, and we would have been dead wrong with some of our assumptions. And we would have been, we would have just missed the boat totally with some of our assumptions that we didn't even make. We wanted data. We wanted to know, what are people seeing, feeling, facing? What are the challenges that are rising quickly? Will they change over time? And we've seen that they have to some level. So building our criteria and then our distribution of the money from the COVID fund to out of real raw data was important to us, and 2-in-1 allowed us to do that. And so when we turned to them, it was an easy number to give out. 2-in-1's not hard to remember, and it was a place where we could send everyone. And so if we didn't have one single portal that we were able to use, this would have been a much more fragmented and chaotic response. Now, the system got overwhelmed at the beginning, so it wasn't a perfect response, but it did mean that we sent everything into one funnel and were able to see what the needs were and make sure that people had a resource where they could ask questions about any kind of need, because there were a lot of different ones, still are a lot of different ones. So you get a specialist when you call, and they're trained to be helpful and compassionate, because people are calling when they are scared, when they are worried about what's going to happen to them and their families, when they need help. They also need a very kind and calm voice on the other end of the phone. So there are great benefits to this 2-in-1 system, and Governor Cooper activated it as the non-emergency information line. So it's activated when we have hurricanes in the county, or I'm sorry, in the state. Typically 2-in-1 gets activated as the place where people call and request help with resources. So we invest in it every day, all year long, but it really, really paid off in this particular situation. Not that it does in every other day, but we could see the direct benefits at a time when we didn't really know what to expect. So where are we now? You know, I started out by saying that we have, oh, somebody just asked, can I access 2-in-1 online and see what they offer? Yes. So you can go to nc211.org and you can get the same help that you get by calling 2-in-1 on your phone. And so at this point, I believe that the system has taken, since the middle of March, almost 50,000 calls from across the state. And it provides data for us at the state level, and then we can break it down to our county level and see what, you know, do we look different than other counties? And in some cases, the answer is yes, and in some cases, the answer is no. But that's real valuable. It's hard to be able in real time to know what people need. And finding out a month later or 3 months later isn't very helpful for folks who are in crisis. And so it's really beneficial that we're going to be able to, or that we were able to see it and continue to be able to see it. So, you know, coming out of this, we're starting to turn our attention a little bit towards recovery. We don't all know exactly what's going to come next. I think that is probably the most worrisome thing, is that, you know, there's a lot of uncertainty, but we're going to move towards what is going to be called the new normal. We are going to have to find some kind of new normal. And so what does that mean for our community as we start looking forward? You know, we know from working with our United Way funded partners, they're seeing a surge in some needs. So we also are getting feedback through them about what people are coming to them or calling them for. We've also seen an incredible creativity in them delivering services in ways that they would have never thought possible before this happened. So, you know, if we had said in the 1st of January, everybody's going to have to go to online, deliver all your services, we just want you to do that, people would have said it was impossible. But it's amazing what becomes possible when you have to. And so we've watched partners who, if you looked at their program, you would have said never, could not be delivered virtually, and it has been. And in some cases, the quality is even better in a way. They're sending really enriching things that families can use in real time or can use later. So, you know, they've had to find different ways of doing things, but they have. And so I'm really proud of the nonprofit sector in our community and the way it's responded to this work and to the needs. And at a time when they couldn't do it in the normal way. So it wasn't just a lot more need, it was needs or services that had to be delivered in a different way. And so, you know, I want you to know that we are well served by the nonprofits in our community. They've done a fabulous job. But, you know, and we also, in our funding, ask them to shift it to the things that we were seeing the biggest needs in our community at that time. So if we were funding you to an organization to run a education program, but schools had closed and the program was not going to be able to move forward, if there was another part of your mission that focused on some of the needs that come through the pandemic, we asked you to move that money over and start responding to that. So the nimbleness of being able to shift funds quickly to be responsive to something was really important. And so if you've made a gift to United Way, you allowed that to happen. You were responding to this crisis before you ever really knew it. Because as soon as we could see a move in needs, we shifted the dollars and asked people to start, you know, our partners to start delivering the services that were being asked for. And so thank you for allowing that, because, you know, when you need help, you need it now. You don't need it 6 months later or in a year. And we were able to do that, and you made it possible. So as we move towards recovery, and I know we have questions in the chat box, so I'm going to get to a couple of them in a minute, but what do we see coming in our community? And this is where I'm going to talk a little bit about that first question around homelessness, and do we see an increase? Right now, the regular needs aren't going to go away. I mean, if you've been struggling with substance abuse, this is not a time when you're not going to have those continued struggles. The stressors of this time mean that those struggles might be even worse. So those ongoing needs aren't diminished. They still are in place, but we now have a lot of new ones, or we have ones that now have become much more significant in our community. And the four that we are identifying right now that we see coming in the near future that we think are going to be critical for our community to respond to are mental health. There is definitely going to be a mental health repercussion of all of this event. We can see that in the calls to 211. The number of calls for crisis are 25% higher than they were this time last year. So we know that people are, you know, have gotten through the first initial shock of all of this when they were looking for housing and food. And now they're recognizing that this has taken a real toll on their mental health, or they're concerned. Their anxieties are very high about their job, or, you know, being isolated. And so crisis mental health has become a real need in the community. And, you know, it's always present, but it's a much higher need today than it was in the past. And we're going to have to, as a community, grapple with that, because we can't just ignore it. There's going to be too many people who are going to aren't going to walk away from this, but are going to walk to the future from this event carrying a lot of mental health baggage that, if we want to be a healthy community, we're going to have to help find ways to make sure we can mitigate that. So there's number one. Number two is education recovery for at-risk students. We know 7,500 of the kids in our school system haven't even signed on to the education portal. So they have gotten no education since the middle of March. And especially for at-risk students, that means a disruption to their education that we may not be able to ever recover from, or they may not ever recover from. Many of them would already have been behind before this point in time. There are many reasons why kids are not accessing the portal, and some are by choice, but many are because there's other obstacles. But we got to figure out who those 7,500 are and make sure that they get access and that they start being part of the education system again. We also need to remember that just because somebody signed in doesn't mean they've been engaged in the learning process. So the school system has done an amazing job of getting Chromebooks in the hands of students, getting hotspots to students who didn't have access to the internet. They have really, moving to an online teaching system that they did not expect would be something they'd need to do. I cannot fault them, but we are going to have children that are going to need a lot of educational recovery, and that's going to be something that as a community will need to be willing to step forward with, because it's not a school problem, it is a community problem. The third challenge we see coming is, and this is around homelessness, this answers that question, homelessness or housing. So for the folks who were seeking rental assistance at the beginning of this because they immediately lost income and couldn't pay either their next month's rent on the 1st of April or they couldn't pay their next week's rent in the hotels, there is a moratorium on eviction. And so if you don't pay your rent, you can't be evicted right now. But that is deferred, not forgiven. And so landlords are going to be expecting to see that rent paid eventually, or they're going to move towards eviction when the courts open up and the moratorium lifts. And then either we're going to see a huge surge in homelessness in our community, or we're going to see a very high percentage of mobility in the community. So people will start trying to move to more affordable places that are usually going to be more substandard in order to be able to get out from under the burden of the rent that's due to the current landlord, or to avoid eviction. So homelessness and housing are going to be an ongoing challenge in the community. If you lost your income and weren't able to pay your rent immediately, you're not going to have reserves that you can turn to pay 3 months worth of rent later. And so people are going to be struggling with that. It's real. And so that deferred rent is going to become a burden that some people are not going to be able, many people I'm afraid are not going to be able to pay, and they're going to find themselves homeless or verging on homeless. So I do think we're going to see an increase there. And then the fourth challenge that we see coming, I think, is the getting people back to work. Some people are going to be able to go back to the jobs that they had, but some jobs have disappeared. And so people are going to need help. They're going to need help writing resumes. They're going to need help with skills training. They're going to need help with knowing where to look for jobs and how to access them. We are going to need to make sure that that's on at the top of our list on being able to be effective for folks, because that's what they want. This pandemic disproportionately affected the working poor, people who go to work every day but don't make a real living wage and don't have any reserves. So if you were living with help from assistance, government assistance of some sort, that's continuing. But if you were in the working poor, those are the jobs that disappeared overnight. And so these are folks who want to work, who were working and want to go back to work. And we're going to need to, as a community, help them be able to do that. And so those would be what I would see as our 4 top priorities and needs coming at us: mental health, education recovery for at-risk students, helping people get back to work, and homelessness and housing needs, and rental assistance for those who have back rent. Because if they can pay the back rent, they probably will be able to keep themselves going, maybe moving forward, or at least a lot more will. Those are our 4 top things that we would see coming at us. So let me turn to some of the the questions, make sure that I'm looking at those. What do you think this pandemic has brought to light about our community? It's a great question. What I have found in a disaster in any community is you see the very best and you see where the weakest areas of a community are. And usually the very best are the people who are willing to step forward and go out of their way in order to make sure that others don't suffer any more than they need to. And we saw a lot of that in our community. We continue to see a lot of that in our community. And that's the thing that keeps you going every day, is watching how people are willing to give, even at a time when everyone is facing uncertainty, everyone is fearful for their family and their health and, you know, all of those things. This is fairly unprecedented. You still see an awful lot of good. And we know it's here. We see it all the time, but you especially see it highlighted during a disaster. And that was really evident in our community, still is. But it also tells us where the weaknesses are and kind of lays those out in more stark relief for us. So we did not know how many people were living week to week in hotels and motels in our community. And we didn't realize that, you know, we all know and we talk about the number of people who aren't making living wages and, you know, the working poor, that they are not part of systems. And because they are able to kind of just keep themselves and their families together, but they have no extra. And this brought that population and the challenges that they face very much forward to all of us who work in the human service systems, and really to all of us across the community, if you're paying attention, that, you know, these are people who can't work from home. Their jobs don't allow it. Their businesses shut down. Many are restaurant, hotel workers. And so right now, they're wondering, when do they get to go back to work, if they'll be able to go back to work. And if they can't, what job in their current or previous industry, what jobs will be available. And so I think that that is going to tell us that there is the level of need in our community will continue to shift, but it'll continue to grow. So as we look at 211 today, when we started in March, the calls for food were very, very high. They're not very high right now. They're much lower. I can speculate on why, that unemployment dollars are flowing, that people have gotten stimulus checks, that they're able to, you know, pay for food. We're still seeing very high levels of calls around housing assistance and concern about homelessness. Those continue. Mental health calls weren't real high at the beginning of all of this. They have become much more prevalent in calls that we're seeing. So the needs will shift, but I think what it has said about our community is what probably every community is finding, that our safety nets are not as deep as they might need to be for people who go to work but don't make enough to be able to really be prepared for an event like this. And well, if we had sat down and had an exercise, we probably would have assumed that to be the case. But now that we have, you know, been through the last couple of months, we know it to be the case, and it's something that, you know, we're going to have to grapple with because they live on the margins, and in this particular situation, that they were pushed over the edge of that margin. So somebody had a statement, not a question. I want to thank you for 211. I was able to get help for my mother. Thank you for letting us know that. You know, we know that people are calling, 50,000 of them, and we know that, you know, there's lots of information coming out of it and stuff, but it's always good to know that somebody had a good experience. That's why we want to make sure that it's in place. So thanks for letting us know. So the cases in Forsyth County are growing, and as a result, do you think this fund will exist longer than anticipated? That's also a great question. The last couple of days we have seen a significant growth in the cases in Forsyth County. We had 100 new cases Monday and Tuesday, and up to that point we had less than 400 in total. Now, conversations I've had with a couple of people, we're doing a lot more testing, and so the more testing we do, the more we're going to find cases that would have gotten somehow biased in the past. So, we need to know that, or be aware of that. But I don't think that we assumed that this was going to go away anytime quickly. And so the fund will remain open for the foreseeable future. We are not going to see $1 million gifts coming in from corporations. They did that at the beginning, and they were very generous. But it's growing because regular people like you and me are going in and making a gift to it, and it continues to grow. So people still care and are still making contributions to it. And again, the needs are going to continue, not just because the cases are growing, but because we're only going into phase 1 in our state. We don't know how long we'll be in phase 1. And so if you work in a hair salon, or you work in a restaurant, or your job is you're not seeing it come back real soon. And so those needs that we were funding through the COVID fund, for some people, are going to be ongoing and are going to grow over time or deepen over time. So we'd like to keep the fund open as long as people are still giving to it, because that's what tells us there's value for it in the community. We do have a donor, a United Way donor, and a generous community person who he and his wife have developed a sign program, I guess, or initiative, that they have printed signs up for people to put in their front yards, encouraging them to make a gift to the COVID fund. And so hopefully we're going to see people become more aware of it and go to it, because we have a lot of people in our community who need help, but we also have a lot of people in our community who can help and have been stepping up. And so if everybody who can help does, the fund will be able to continue for the foreseeable future. So I don't think when we started it we had a plan for an end date. We didn't say, hey, we'll assume it'll be closed in June. Right now we've probably got about 250,000 or a little more than that in it, and we're going to wait right now and on dispersing those funds. We got the first $3.5 million out the door very quickly to 75 agencies with a variety of needs that they were ministering to. But we know that there's going to be some emerging needs that we can't quite see yet. And so those 4 that I listed, those are going to be 4 ones, but I think there's probably going to be others that I didn't list. And so we want to have some funds available to be able to address something quickly if it suddenly comes to light and we weren't able to anticipate it. So right now, we're not going to be planning to grant those last dollars out in the really quick future, but we obviously are not going to sit on them if there's a need that arises. So, and every dollar in there will be granted to something that has been arisen because of COVID, but we don't want to see something come up at the end of June that means we don't have the dollars to respond to at all, and it's a crisis in our community. So trying to be a little fiscally conservative around holding some dollars to be able. Do I think that this will change how we educate children in the future? Boy, it's a big question, and I am not an expert to answer it. I think the school system's grappling with that. I had a call last week with the school superintendent, and they are struggling with that. They don't know, are students going to be able to be in a building or not? Are they going to be able to be in a building? Are they all going to be able to be in a building at one time? Or are they going to have to be, half in one day and half in the next? I mean, they just don't know right now. And they're trying to figure that out. So I don't know what this means for education in the future. I know more in my realm. What does it mean for work in the future? And are we going to work differently? And I think probably we will, but I just don't know about education and what it means. My kids are all grown, but when, I had 4 of them and they were all pretty close together. And so I think about that. If they had gone to school, a few days a week and been home a few days a week, or if I had been there, teach them the same time I was working, parents are really struggling with this. And so is that a system that we could allow long term? I don't know. Interesting question, but I don't have an answer. A lot of people are saying life will never be the same. Do you sense, you work for the Red Cross, do you agree? Or do you think we'll be normal again? Most disasters have a time limit to them, and they are also geographically boundaried. So when you're talking about a flood or a hurricane or tornadoes or, a terrorist attack, it's boundary. And this particular event isn't boundary. It's everywhere across the country. It isn't a one-time episode. It's not an episodic event, it's an ongoing event. So I don't think life will ever be quite the same. I'm not saying it's going to be worse. I don't know that I think that's the case. I think it'll be different. I had a conversation this morning with my board chair, and she said, are you going to change the way, are you going to have everybody come to the office all the time like you used to? I mean, when it's safe to do so. And I said, probably not. We've been working very productively from home, and so we're probably still going to do more of that than we used to. We used to have some, we did some of it, but we'll probably do more. And I suspect that a lot of, this is kind of deconstructed our expectation of we get in the car and we drive to work every day and we work there because that's how we do it. So things like that, I think, are going to change. I don't know if that's a good thing or a bad thing. I think it just is. I think we'll be a little more aware of health and about being careful about germs and spreading germs and things like that. I mean, I think we'll learn from it, but I think our new normal will feel like normal fairly quickly. We adjust, and the human brain kind of adjusts to the new normal, and then it's normal. And I think it will be. So will we go back to the way everything was? Probably not. Does that mean it'll be worse? Probably not in the long term. But if you're somebody who's been affected by this in the short term, where your industry has disappeared, your job is gone, there's going to be a much longer term effect on you. And I think we all need to be aware of that and understanding of that. That one of the things I found in disaster was, especially I had a lot of experience with flooding where I lived in New York. And if your house was flooded, this affected you for years. You had to take the whole inside of your house apart down to the studs, bleach them to get all the mold out, and then rebuild. But when you drove by somebody's house on the street and your house hadn't been flooded, you thought this was over the minute you couldn't see water. I think we're going to have a lot of residual effect like that in our community. That if you kind of are going to go back to your normal life after this, and maybe you work from home more, but everything else seems the same, you're going to think that we've recovered faster than those who had a direct impact on their lives. I want to say thank you for the fund and also 211. I heard about it, but I'd never had a need to use it. But I saw it on your Facebook page and was able to get info for my neighbor who's elderly and needed food assistance. Wonderful. That's why it's there. And thank you for caring about your neighbor. I think that is the key here, is if we care about each other. I know it sounds, corny and hokey, but it's the caring about each other that's going to make us come through this okay. We are in this together, and everybody's saying that, and it's true, because any one of us could catch this, and it's not going to discriminate. We can't all say, well, that won't happen to me. We don't know for sure it won't. And so it's exposed vulnerabilities in all of us that we have to be aware of. But I do think that as I look at some other places in our country where people have not been as careful about observing the protocols, about staying home because they've been asked to, we can see North Carolina has done a great job of keeping this minimized. Every single death is a loss. Every person who's had to go through it is an awful thing. But North Carolinians have been very responsible to each other. And in doing so, we've managed to keep probably the worst of it at bay for our community and our state. And so that's being kind to each other, and we have to keep doing a lot of that. And we should be proud of that. We should be proud to be part of North Carolina, and you should be proud because you were one of the people doing that. And so I think that we, this isn't a great example of reaching out for your neighbor who's elderly and needed food assistance, instead of assuming that they could call on their own or that they would take care of themselves. I think the more we help each other, the faster we're going to recover from this. And the more we're going to feel good about that recovery. So what can the community do to support students and teachers as a result of COVID? That's a great question. I mean, if you know a teacher, thank them. I cannot imagine suddenly having to do everything online. Teaching is a really, really hard job. And, I do try to play out in my head what it would feel like and I know many of you know this, how is it to be home, to have a job, to be trying to be your child's teacher, all at the same time? I don't know how you do it. I could not. I say that if I had to, I probably would, but I look back and I just think I would have been awful. I had two kids who would have just done all the homework and then done the homework for everybody else. But then I had two who I would have been fighting with every minute of every day. And so I think for teachers, I think we're all getting a better appreciation for how hard their job is. Convey that. Let them know. We've had some online opportunities for you to go on and send a thank you note to a teacher or a note of appreciation. Do things like that. Utilize those and send them, because it really does matter when somebody says, I appreciate what you do. I now really value it in a way I couldn't before, and I want to thank you. That's a terrific message. For students, there's a lot of things that we may all have to do. And so, we're having conversations with the school system about what things are going to look like going forward. But we may need to call on community members to become mentors and tutors and help deliver food and things like that as we head into what recovery might look like. The children who are not signed in to the online portals are not going to suddenly come online because somebody sent out a note and said you should, or we all start talking about the fact that everybody should be on there. It's going to take some kind of personal intervention, some kind of personal relationship with them or their family to say, this is important, how can I help you? So there isn't a parent in the world who doesn't care about their children and who doesn't want the best for them. But when you're overwhelmed with having to go to work every day still, and not having any childcare available because schools are closed, and having older children needing to watch younger children, and you not being able to oversee education, even if that wasn't the case, it becomes a priority listing. And if I have to choose between making sure that my child's doing online education and keeping a roof over their head and feeding them, I know what I'm choosing, and it's going to be the roof and the food. And those are choices parents make and have to make. And so those of us who can step in and help support around those families may need to. And so you may be hearing back from us and asking you to consider being part of that over the next few months so that we can help children start to recover. So stay tuned for that. That's a good question. And you know, we're talking about what that answer is, but it's not going to be a hands-off answer, because that just isn't going to get us where we need to get to. It's going to be a kind of all hands on deck answer. So I appreciate you asking that. Last question, how do you remain, oh, not the last question, but how do you remain positive? I wouldn't want your job for anything. You know something, I mean, I have my days, I'm up and down like everybody else, but never because of the work. I think the down is because I don't feel like I can do enough fast enough to be all that I need to be when our community needs me to be everywhere and doing everything at one time. But, you know, remember what I said before, these situations let you see the very best of people. And I focus on that. I am never more reaffirmed about my belief about the goodness of humankind or mankind than I am in a disaster. And I watch that and I recognize how much we really do care for each other. And it's a privilege to be able to be on a front line to see that. And so it's easy to remain positive when you are thinking about that, you know, we're in this together. None of us are doing it alone. And that we need to rely on each other, and people are stepping out and saying, you can rely on me. So the positivity isn't that hard. And typically I'm fairly upbeat anyhow. I want to help, and my husband and I gave to the COVID fund, but my father-in-law, who's medically compromised, lives with us. How else can we support the United Way as we are limited due to concerns for his health? Well, I think that as we go forward, so when we're talking about that we may be looking for tutors and mentors for students and things like that, I think a lot of this is going to be done online. I think that, you know, we're not going to be able to be virtual or be in the same place with people as much as we used to be. And so I think that there's going to be an opportunity for you to do things from home that in the past maybe you couldn't. But in the meantime, keep an eye on our website, the United Way website. Oh, by the way, thank you for giving to the COVID fund. I want to make sure I say thanks. We really appreciate that. It's helping someone right now. But keep an eye on the website and look for opportunities to do virtual volunteering. We're putting them up as we can find them. Send encouraging notes through the website to those who are on the front line in our community. You know, there are a lot of ways to help where you don't really have to be out and in fact, there's probably more of them than ever today. But you know, your priority needs to be your father-in-law and making sure that he remains healthy, and you know, no one would ask you to do anything else. Please keep that as your top concern. But keep an eye on the website and, you know, look for information from United Way, because we're trying as hard as we can to find ways for people to be engaged and involved, even from a distance. I know we all want to help and we all care, and it's hard right now to know how to do that. And we're all learning, just as every other part of this disaster is a lot of learning and unexpected pathways. So is how you help is different as well. And you know, but keep looking, and you'll find your way, and we will do our very best to give you those opportunities. I'm making masks. How can I connect to you guys to give them out? I am not sure if we are doing that. There are several mask projects in the community that have become very significant, and I think that they probably are the better place to get masks to, because they have the distribution points. but we can get that information out to you about where those are. So I'm not trying to, push you aside on that one. So I made masks too. But we're probably not the very best distribution point. At the beginning, we were doing that because we didn't see others doing it. But now there's been a couple of, kind of ad hoc groups that have risen up and are, making masks by the hundreds and thousands, and we're awfully lucky to have them in our community. And so I think probably they would be the better place to make sure that it gets to someone or to one of the institutions that is really needing them today. So thank you though for making masks. There's another way that if you had said to us 3 months ago, oh, make masks, you can, if you sew and you have fabric, make masks. We would have thought that was crazy. Just order them, and or why would we need all these masks? But people looked around and said, what is it that we need, and what can I do? And so we have companies who have done the same. That Hanes brands saw a total disruption in what they did as a business, but they looked around and said, masks. People need masks, and we can start doing that. And so we've seen that at the corporate level, and we've seen that at the personal level, that people have stepped into voids where they can see that there's a need and started to fill it, not because somebody asked them to, but because they realized that they could. And so, thank you. I mean, this is why I'm positive, because you see that all over the place. Can I share a feel-good moment I've experienced during this crisis? I don't actually know that I could share one. I could share lots and lots of them. I look around the community and I look around those who I work with every day, and I see people doing what they and I would have thought impossible a couple of months ago, and yet they're doing it, and they're doing it well, and they're doing it with grace, and they're doing it with indulgence for when someone needs something more from them. So, I think one of the things, one small thing, we've had conversations with our partners about one of the challenges in our community is transportation. And so is it possible to do more of the services that they deliver? Could they do more of it virtually? Could they do things through technology? We had these conversations over the last last year with them about that. And the answer we now know is yes. We can do some of these things, a lot of these things through technology. And so I think that, for the challenge is going to be, let's not let that learning go. Let's not try to revert back to, well, let's go back to the way we did it because we like doing it that way, because doing it this way means people can get access without having to have transportation. They can do it from where they are. That's a huge, impactful learning for our community, and a way that services will be able to be delivered into the future that'll be much more effective for many in our community. So I see something like that, and that makes me feel good that even though we kind of got forced into this, we now know that we can do things in a way that will be a better method of delivery for people who are struggling at any given time. I look at the United Way staff and I think about, we basically went in on Monday and said, you're all going home today, take everything you got and don't plan to come back. And the level of productivity that we have had and the way we have risen to the needs in our community has been heartwarming and inspirational. And I see that across all of our partners and our partnership with the Winston-Salem Foundation. We tried to open up a fund that we had never done. We did it together. We did it virtually. We threw different parts of our teams into one room and basically said, here, let's figure this out. And we did it really well. It was quite impressive. So I can't tell you how many good times there have been along this. And I want to say thank you to you for being part of this today and for listening to us and listening to me talk about my experience. And thank you for all your good questions. We really appreciate that as well. Thanks for everything you do for United Way. Thanks for being engaged with us. We're going to need to continue to live united as we go forward, because that's the only way we're all going to get through this together and be successful on the other end. But we can, and we will. So thanks.
Cindy, thank you so much for your time today, and for everyone for all of the great questions and the insight that we received. We'll probably be doing these again in the future, so stay tuned. In the meantime, we will be posting this video for everyone to view once we have wrapped it up. And if you have other questions, please feel free to ask us on our Facebook page. Please be sure to check out our website, forsythunitedway.org. 211, which Cindy mentioned earlier, can be dialed from any phone. And the website again for that is northcarolina211.org. But thank you everyone for your time today and your energy. And Cindy, thank you so much for taking the time out of your day to kind of bring us all together and update us on what the United Way is doing, and like, again, answering such great variety of questions. So we appreciate your time.
No, thanks for asking. I appreciated it.
Great. Everybody have a great day and stay safe.
Yes. Thank you.
Thank you.